Good evening, my name is Sophia Matovu and you're tuned in to You Health Chat, proudly sponsored by National Medical Stores. We are here practically every Thursday to share with you topics that will help you to be able to pick a leaf and be able to learn how to live your life positively while taking care of your health. Now, it is a fact that non-communicable diseases kill about 41 million people globally. It is a fact, trust me. Now, today in studio, we are going to talk about a discussion in line with non-communicable diseases. You know, it is a growing concern, a very, very big growing concern. With each year, you'll see that the cases go high, but certain times we are not able to identify that this is exactly what it is. I'm not the expert when it comes to these matters. With me in studio tonight, we are privileged to host Dr. Sekweyama Peter, who is the clinical director and as well as an obstetrician gynecologist at St. Francis Nsambya Hospital. It's not usual that we get to bring people of his caliber, but I would say I'm very privileged to host him tonight. Okay. Doctor, good evening.
Good evening, Sophia.
How are you?
Thank you very much. I'm good. Happy to be here. Thank you for this invite. I hope we'll have a good time explaining our challenges today.
Now, Doctor, I would like to start with, when we talk about non-communicable diseases, some prefer to call them the lifestyle diseases.
Yes.
You might have a way in which you can better tell the public what exactly they are.
Okay. I will tell you one, like you've said, well, public. A non-communicable disease is a disease that does not come from an acute infection or infection. These are conditions that will come from non-infectious agents. And on the academic side, I usually want to add two things. One, it is a disease, first is a disease that is not from acute infection. And two, it leads to long-term illness. And three, it requires long-term treatment. So these non-communicable diseases, you won't have to get, let me say, mosquito bite, then you get malaria, or like, these are diseases that will come because you have particular risk factors to them, particular habits, particular, genetic predispositions and the like, and then you get the disease.
Okay.
Thank you.
Now, because the topic, by the way, is picked from a social media poster that we saw the hospital put around, and it intrigued us, and we're like, this is quite interesting to see that the hospital is raising this concern. By the time you choose to say non-communicable disease is a growing concern, indeed it is.
Yes.
Why is it a growing concern now?
Just like you said in your introduction, Sophie, non-communicable diseases are a growing concern. We are really worried that, we have been used to infections, malaria, HIV, and TB, but non-communicable diseases are increasing in mortality. If you were to look at the causes of mortality globally, just because COVID came in those years of 2020, 2021, but by 2019, among maybe about 5 billion global deaths, 55 billion global deaths, 41 billion of those were due to non-communicable diseases. And now, to make matters worse, these infections sometimes also take advantage of individuals with non-communicable diseases and make their outcome worse. Not that we love death, but there is what we call premature death. Premature death is death occurring before 70 years on average. And almost 85% of all premature deaths occur as a result of non-communicable diseases. And we are just seeing that it is a growing trend. A growing trend. And somehow we get lost thinking, oh, infections, and now these non-communicable diseases are on the rise. Okay, while we were looking at HIV, TB, malaria, and all other things, these things have started, and they are increasing, and we are seeing where we are going is not good if we don't do anything about them. Yeah.
Now, in terms of you as a hospital, I believe the non-communicable diseases, of course, are in different categories and different types. What are the most prominent cases that you seem to be seeing on average in the categories of these non-communicable diseases?
The commonest actually in Uganda is mainly cardiovascular diseases.
Really?
Heart diseases, heart attacks and the like, hypertension, chronic kidney disease, diabetes mellitus, and mental illnesses are also now on the rise. We tend to think mental illnesses are only the patients we see in the, admitted in, for example, with Tabika. But there are many people moving around with things like depression, anxiety, post-traumatic stress disorders, and that is a mental illness, and that is a non-communicable disease. So even in the children, we see a lot of things like epilepsy, cerebral palsy. All those are things that, we got lost. We look more to infections and other things, and now these funny conditions are creeping up. They are creeping up and what? So it's mainly cardiovascular, diabetes mellitus, hypertension, and mental illnesses. There are chronic chest infections, chronic obstructive airway disease. These are things that would occur later in life when the lungs can't expectorate some of the, the secretions produced, and then they cause challenges, someone breathing. Yeah.
Now, doctor, when you talk about the cardiovascular diseases, it's a little bit worrying, because I don't know why people think the mind has failed to acknowledge that this is actually what happens. And when they say somebody has died of a stroke, somebody has gotten a heart attack, they do not believe it. Why do you think it turns out that way? They will always think there's another underlying cause.
Okay, they may be right in a way, but also wrong. There's always an underlying cause for someone to get a heart attack. Okay? For example, if we start from this, as we are saying, non-communicable diseases, non-communicable diseases have risk factors, and these risk factors come from like behavior, genetic predisposition, and the like. So if you're someone who has a genetic predisposition to heart disease, for example, first degree relative, your father passed away, got a heart attack, you have a sister, a brother, or an auntie, and then you are not keen to follow up on your cholesterol levels. Okay? So what this cholesterol does, it creeps into the blood vessels, makes them thick, makes them hard, and makes bumps in them. And then as blood flows through them, when it goes over that bump, a clot is formed behind. And sooner or later, either this clot is thrown further, and then it goes and blocks smaller vessels, which gives you a stroke, or this swelling occludes that vessel and then decreases on the blood going to the area where that vessel is going. So these things, yes, happen, but there is an underlying cause, which is the risk and sometimes our behavior, okay, that then give us this.
Okay. I'd like you to tackle the bit of our behavior. That is one of the factors or the risk factors that is leading to the increase of non-communicable diseases.
So I mentioned there's a sedentary lifestyle, a lifestyle where you do not do physical activity, exercise, alcohol intake. Alcohol intake should be moderate. Sometimes it gets a little out of hand, and then eventually we can then even poor diet. Okay, poor diet, like I mentioned, the cholesterol issue. I mentioned the sugars that then take you to the side of diabetes. Yes, smoking, tobacco is a big risk factor for some of these obstructive airway diseases. So there are lots of things that happen within our lifestyle, actually, that actually either make someone with a risk factor prone to the non-communicable disease, or it comes in earlier than we would have expected, hence the premature deaths being many.
Okay.
Yeah.
Now, St. Francis Hospital in Nsambya, how did you come up with the idea of an open day, and you chose to specifically target this area that is very worrying?
Thank you, Sophie. Now, an open day is something we should do every year, and this is required by our regulators, where we give back to the community. Community are the patients we see, the visitors, the stakeholders that we work with. And within this open day, we offer treatment, and then we also give a report to the community of what we have done, what are the services that we've done, what have we brought on board, and what is Nsambya doing for the community that we serve. And again, back to your introduction, you know, as we were thinking out what to do for this open day, the issue of non-communicable diseases came. It is really a growing concern. World Health Organization is paying keen attention. Actually, it was shadowed by what COVID and the other infections did in the past 2 years. But the direction WHO was taking was practically tackling non-communicable diseases. Luckily, even the country, as Uganda, is doing a lot of, you would be surprised if you didn't know that the fight against tobacco, you know, there's a bill against selling cigarettes, I mean, advertising in public, smoking in public. Parliament even has a non-communicable disease policy and forum upon which, you know, some of these objectives are set and help us in doing policies and some of these decisions. So, and we are seeing these patients come. Okay, they come. We have hypertensives, we have diabetics, and what, and these risk factors are actually modifiable. Okay, if we detect these things early, we modify the lifestyles, try and prevent complications of these non-communicable diseases, and minimize on the people who pass on as a result of these non-communicable diseases. So that is the idea that we had in creating this theme of non-communicable diseases as a growing concern. After seeing what impact it has, actually, I'm sorry I haven't said it, because cancer actually is also a non-communicable disease, and it is also on the rise. It's out there. Most of the deaths we are seeing of late, cancer and the like. So as a hospital, you know, we are seeing all this come, and we want to go out to the public and try to teach people how to, one, look after themselves, and two, to do early checks. We call it a wellness check. You know, there's a wellness check for an 18-year-old girl. There's a wellness check for a 20-year-old boy. Okay, and then there are different grades for wellness check. Walk into hospital when you are fine, okay, and just check, you know, my kidney is fine, my liver is fine, and the like. So at the end of the day, what the objective of this open day is, yes, we go out, screen, but also teach people that, you know, look after yourself in this way, okay, have a regular health check, and you know that, you know, this is okay. Yeah.
And what about the scare? You know, there are certain times, it's a mindset, I think,
Yes.
where people believe the only time they should walk into a hospital is when they're feeling unwell. The culture, we do not have the culture of walking into a health center just for a wellness check, because one, even also we are like, you have to pay a consultation fee, and that really makes them do run away. What do you plan? At least I'm glad on the open day people will have all these free talks. How do you intend to help people feel comfortable to know that wellness is something that is very important?
So, for example, for the wellness, for the open day, we are going to offer free tests for whoever comes into the hospital for that day, okay? Because it starts from just blood pressure check, weight, your height, and then we calculate your BMI, and then we know whether you're obese, you're overweight, and what, because that is also a risk factor.
Yes.
Then we are going to screen for cancer, free breast cancer, cervical cancer. We are going to check ladies for cervical cancer. We are going to have screening, by the way, even eyes. Okay, eye checks are going to be there. We'll screen anterior chamber problems, posterior chamber problems, and also be able to give out free spectacles for people with challenges, with even dental services, by the way, because oral care is key, and it's also part of non-communicable diseases. And we shall be screening for oral problems and the like. So now, on that day, which is tomorrow, we are going to be offering these services free. Now, the beyond, for example, if I have seen someone and she has a breast lump, unfortunately, we can do a free ultrasound on that day and the like. We usually have a particular cost for a mammogram. Okay? We are opening up this service for a period of a month from the open day, where they will have subsidized mammogram. If I see you and you need a mammogram during this open day, you'll have a month to come and get subsidized. Even these wellness packages, okay? The packages, of course, they're not very highly priced, but for someone who has been with us in this open day, we will have a whole month where this patient can actually come and access subsidized wellness packages.
Wow, yes. That's a very good one. And then that will help do the follow-up for about a month, for a period of a month. I believe previously you've had open days before.
Yes.
What's the success you have tracked with them for, let's say, like if you did one last year?
We had an open day last year, which we shared with the midwife and nurses training school. They were celebrating 100 years in existence.
Wow.
And first of all, we were overwhelmed by the patient number. We did everything from seeing babies, children, adults, elderly, eye problems, dental, mental health checks, counseling, HIV. Now, this was not specific to just non-communicable diseases. A month after that, the backflow was still coming to the hospital to try and get some of these services. People are stuck there. Like you said, the culture is, you know, if I don't feel sick, why should I go to hospital? And that is an objective we really want to achieve as the hospital, to try and tell the public, teach the public. I am not happy when I examine a lady and I find advanced cervical cancer, because this is a cancer that has averagely taken almost 10 to 15 years to get to that stage. Yet, 10, 15 years ago, there were some changes on her cervix which we could have detected and probably even treated, and she would be better. So that is the state in which we are in at the hospital. Why should someone come with a stroke? Why should someone come with a heart attack? We should have been able to detect cholesterol challenges. We should have been able to detect some challenges with diabetes, hypertension way earlier when this person walks in. I should say, fortunately or unfortunately, we are a not-for-profit organization, private not-for-profit, but we depend on what patients pay to offer a subsidized service. We cannot have them free, for example, throughout the year. We need to survive. But we try as much as possible to keep them within acceptable limits. You know, the owners of the hospital, which is the Archdiocese of Kampala, they always said, what are you doing for our, disadvantaged patients? What are you doing for? You should have a service that is more affordable to them. And that is the direction we are taking. market the wellness checks, and so that we can pick these things quite early and prevent what is happening. It's not nice.
Then how are you planning to deal with and manage the open day? Is it a criteria of first come, first serve? Because, you know, there are certain times when you talk about the disadvantaged, or there are certain times when there are people who believe, like, when you want to get the best services and have always wished to come to that hospital, will move distances. Trust me, some people even come and be queuing as early as I don't know what time. How do you intend to see to it that they are given that special priority, given the distances they have traveled to come there?
It's going to be a challenge to know how far someone has come. Of course, in our register, we shall put there where the person has come from, but that is when the person has actually reached and is being registered. So it's there's no way I'm going to tell her get out of the queue and the like. We then have a triage station next there where we can actually pick the ones who are really very sick, and then we go on. We are starting actually at 7 a.m.
You're starting at 7 a.m. tomorrow?
Yes, regardless of other programs ongoing. We have mass, we have a presentation of the report by the CEO to the community and a couple of speeches, but the medical team will be working and seeing patients the whole day till about 5 or 6 p.m. Unfortunately, it has to be a day to fit within budgetary allowances, but then, like I said, we have an extension of close to a month where other services are available, but again, subsidized. Like you said, the open day we had last year, the overflow was too much, and we had to do maybe about 30, 40 more patients in eye clinic. We had to do about 50 more ultrasounds the next day. Then we had to do a couple of other consultations, you know, 2-3 days later, trying to mop up the leftover patients for the open day. I think and believe we may have more. We hope we have the capacity to, you know, mop them up and make sure we have left a significant number satisfied. Yeah.
Now, talking about the non-communicable diseases, which category and age bracket is more at risk?
Now, usually, commonly, of course, it is the elderly, but I don't, myself, I don't have that perception, because this starts when you're younger. It starts when you're younger, you have the risks, okay, and then the behavior and lifestyle things come in play, and then you stay with them until you get older, and then it hits you at that stage. So, and that is the idea that we had for us to introduce wellness packages at all age groups, starting from 18. Okay. So, I don't know, I hope none of my teachers of medicine is listening to try and say, you know, that, but that is my feel now. Like, this risk starts way back. And you know, you ignore it, and you know, you move with it throughout life, and then hits you at a later age. So I'm not going to say this particular age group and the like. The challenge why I started with the elderly is that now the risks are more at that stage. One, you are older, your immunity is lower, you're at a higher risk of being sedentary and doing less exercise. So yes, in a way, the curve is skewed towards the elderly, but I believe the whole risk is across board.
Wow. Okay, at this particular time, I'd like us to take a very short commercial break, and when we do return, we're still going to continue with our topic of discussion.
Are you tired of high fees and slow transfer time when sending money? Look no further. Airtel Money is here to revolutionize the way you move your money. We have revised our rates, and now sending money from Airtel to other networks in Uganda, East Africa, and to the rest of the world has never been more affordable. Plus, you can trust Airtel Money to get your money where it needs to go quickly and safely. Simply dial *185# and start sending money. Switch to Airtel Money today and experience unbeatable rates and top-notch services for all your local and international money transfer needs. Airtel Money. Instant, secure, borderless.
This isn't just a girl. She is the future. This is a teacher, a doctor, a community leader, our future president.
She is the future of Uganda. And as a policy maker, the policies I enact today will protect her from child marriage and teenage pregnancy. We each have a role to play in empowering our teenage girls to protect them from child marriage and teenage pregnancy. Because when we empower them, we empower our nation. Protect the girl, save the nation.
Take action. Report any case of defilement or child marriage to the police or call Sauti 116.
Jerry con. Jerry con. Hey, Master Blaster. Touch him, man. Bang Jerry con with muscle. Those ones who say go for you only. Mundava. Best movies I teach you. When I go to which the scary because of the camera is very far. Is you serious? It's serious you. What? Yeah? You step it on it. Add kilometers to your legs and you get your sugar. We buy milk from Umaru and Umaru refused to give you enough meat. Mama! Show him that they don't joke with you. Umaru,
Okukakaluka n'okulungi kwetaagako omuntu akuyambako. N'olwekyo tujja kukuteerawo embeera esaanidde osobole okukola ekisinga. Awamu teri kitulema.
Welcome back from that short commercial break. You're still watching You Health Chat, proudly sponsored by National Medical Stores. And of course, we're talking about non-communicable diseases that are a growing concern. And with me in studio is the clinical director of Nsambya Hospital, Dr. Sekweyama Peter. Now, Doctor, we're still talking about this topic, and we're talking about an activity that you have brought out to the public's attention and a bit to talk to them about that. Now, there are certain times we have a challenge with some of you medical people in terms of the medical jargon.
Yes.
How do you break down this information to a lay person who come for the open day, for them to be able to understand and later appreciate and change their lifestyle, given different categories of people expecting from the different walks of life?
Yes. That's tough because it has to be individualized to each patient who comes. Okay, individualized as in language, even comprehension of the particular challenge that the patient has. But we have a team of senior consultants, and specialists, along with nurses and lab technicians and assistants who are actually ready. By the time I came here, all the tents were ready and the like. What we want is that one-on-one. Once I'm seated with you for the language you'll understand at that time, I will break it down in that way. This morning I had a challenging one on radio in Luganda, and it was tough. But then I made it out without sweating. So now when I'm with a patient one-on-one, we are doing this one-on-one. That's why we said free consultation. Like you said, sometimes the challenge for most people is consultation. Okay, I want to go and sit and talk with a doctor, and he tells me about my problem. Okay, so that alone is going to happen free of charge. Okay, and we are going to blend it with, once you come in, we deal with your problem as you've come. That's why we have triage and the tests first, and then we know where you stand concerning your diabetes, your hypertension, your BMI, if it is a breast lump, breast cancer, if it is a cervical lesion or the like, if it is something in the eye. So it's more of the one-on-one, you know, because we love to have this. Like you've said, we have people who even just pass the hospital and they're like, oh, I won't afford consultation and what. So if we open the door and someone comes in and is seeing a senior consultant and discussing issues about his or her health, we believe it's taking an extra mile, okay? In one, changing this person's behavior and also changing the health-seeking behavior, okay? Because say, you know, once you go somewhere, you'll just go to see a nurse, you're going to see it, but then now this person is going to come and is going to be seeing, you know, specialists upwards, okay, to deal with or discuss their issues. So,
I'm glad with the approach that you're using, the fact that, you know, tests are also part of it. I have seen some medical camps, and what they'll do is they'll line up the antimalarials, the paracetamols, the dentist will be there, where tests are not done, and they'll do clinical examinations, I think that's what you call it, and then they'll based on that to give a prescription. Then what's the plan? Like if people have, there's some situations or conditions that you're possibly going to come across that will not just go away, that will require more than the required arrangement of possibly medications you've planned to have out
what
there.
is available. Okay, first of all, we anticipate getting patients, for example, who are hypertensive. We also have free antihypertensive medicines available. We anticipate to get patients who are diabetic. We also have free anti-diabetic medicines available. And these have been made available to us with some of the stakeholders with whom we work. Our intent for that, I may expect to see someone who is hypertensive and has been on medication for some time. That person will come. I will see that person will be assessed for their cholesterol. If he's a man, he will have a prostate exam, he will have a blood test for the prostate, and can also have an ultrasound done for the prostate. But for someone who on that day we diagnose hypertension, we shall be in position to give this patient a month's treatment free. Okay? And then we hope and anticipate that this person can then be able to continue on their own once we've started this medication. The same with diabetes. We are going to give out also a couple of spectacles for the ones who have anterior chamber problems, refractory challenges and the like. I think that's that. Within our screening form and treatment form, there will definitely be referrals, need for referral. We hope and anticipate, we know that most of the services that are available and require referral are actually available in the hospital. So we are ready and are going to do internal referrals. If this patient has actually been in the open day, the service that this patient would access after that within the month, okay, will be subsidized. Okay, will be subsidized. But beyond that, we believe that that would be awareness enough for the community, the population, to know that, you know, there's a problem here and they need to actually deal with it in a particular way.
Okay.
Yes,
In terms of your anticipation, because I can see you have a properly worked out and ready plan.
Yes.
Now, if you're issuing the anti-hypertensive drugs,
Yes.
and I believe there are different regimens,
Yes.
what is the plan? Should somebody start on the drugs and they are not responsive to that drug? Because there are some who will tell you that particular drugs for hypertension will give them a headache,
Yes.
and
Yes.
possibly they will need to have the drug changed.
Yes.
But now, some people, because of the ignorance, might decide to just dispose of the drugs since they've already given them that side effect.
This patient has a month, okay, during which the
To come
patient
back.
actually comes back to assess, and we're like, okay, this drug is actually not working, or we can switch to another one, and the like. There is that patient that you have said who will discard the medicine and go. And what, unfortunately, these are the patients that we see later in life with a stroke.
Complications,
Okay,
yes,
and then
yes.
you check and they have high blood pressure, and they're like, oh, I got some medicine once and then it gave me a headache and I stopped. Okay, but now this is someone who has a stroke, maybe a couple of months or years down the road. That's an unfortunate situation. We can't foresee that. That's why we have opened up for a whole month for us to be able to either check up and see that this medicine is working, and actually impart more of this knowledge that you need to care for your life. If you're hypertensive, decrease on the salt, try and eat all this, try and do this, do exercise and like. So within this month, I hope we can actually create some impact, yes, to these patients.
What other services do you intend to offer? Let's assume like now, we are done with the day, we are done with the month. What other beautiful services should we expect from the hospital?
Okay, now that's a tricky one. The services you should expect as from the open day.
After the open day?
The open day is what we offer.
You might be
in the
having
hospital.
something new cooking.
Okay.
Because
Now-
there's sometimes when we pass by, you look at your PP.
And you people, and yes.
And you're like, what's cooking there?
The week after the open day, we are going to have a surgical camp for pelvic floor injuries. Okay, I can't miss saying that because I'm an obstetrician gynecologist, and these are things we deal with. We are having a surgical camp free also for VVF. I don't know if I should.
Please spell it.
Okay, that's vesicovaginal fistula. This is someone who went into labor and the baby's head compressed against the bladder, and then now there is a defect where urine just comes out without control. And the same can happen to the rectum, where
yeah,
stool
true.
does. So VVF is when it's urine, vesicovaginal, and then RVF is when it is stool, rectovaginal. So we have a week-long camp where we are going to work on any patient who comes in for screening on Sunday.
Oh, wow.
All other pelvic floor injuries, mothers who have had deliveries and they feel like the stitches, or they weren't stitched right, they feel really uncomfortable, or they weren't even stitched, or they were stitched and the stitches gave way and they didn't get back to hospital. All that discomfort in that area after delivery is birth pelvic floor injuries. And we have a camp where we are going to do free services starting on Monday, but then we need to see these patients on Sunday so that we plan our day free of charge. Okay. What else? We call it prolapse. I don't know how I can. There's a condition that will occur later in a woman's life where the ligaments that support the uterus weaken and the uterus dangles and it hangs out.
Wow.
So we are also offering free services, free surgery for this procedure the following week. But we need the patients in hospital on Sunday for us to screen.
All this is free of charge?
All this is free. The same week, we are also going to be maybe the first hospital that would be offering laser treatment for retinopathy of prematurity. I know you're going to ask me to break
Please
that
do.
up. When a baby is born before it's mature, it's not breathing well, and we have to give oxygen. Unfortunately, if this oxygen is a little higher in concentration, at the back of the eye, there are small blood vessels that are formed
In the baby's eye.
in the baby's eye, and this can cause blindness. So we call that retinopathy of prematurity. We test for that in the hospital, and we treat it. We treat it with giving an injection in the baby's eye, and it stops that the blood vessels from forming. The following that week again, when we are doing the birth injury, we are also going to embark on training for laser. Apart from giving the injection, now we are going to introduce a laser machine that can actually burn those vessels. The advantage for this, and also speaking to non-communicable diseases, the same problem happens for diabetics. Okay,
yes,
and with diabetes, they also get what we call diabetic retinopathy. They also form small blood vessels behind the eye. Okay, it is not very comfortable giving the injection for the adults, but once we have laser, this one can actually go and burn up those vessels and prevent progress of the diabetic retinopathy, and also better the life, the vision of this diabetic. So it is actually a busy apple for the hospital, but all of these services are going to be free.
How do you deal with situations? Because I'm picking interest on the retinal therapy that you're talking about.
Yes.
Certain times, especially the seniors and the adults, when they get to a particular age bracket, are bound to have issues with their eyes as a result of the non-communicable diabetes.
Yes.
But they are not comfortable with the issue of touching their eyes, where they think once your eye is touched, you're going to become blind. It's likewise when they have those wounds that have failed to heal, and they tell them you'll get this condition called gangrene. No. How?
So
Are you going
particularly
to help them?
for the diabetic retinopathy, actually I'm not going to say, I'm not an ophthalmologist, but I have actually had that screening. It's not about an injection in the eye and the one. It's just giving some medicine in the eye so that the pupil, widens, and then they can use a camera to study the vessels at the back of the eye. Simple. No injection. You can actually drive to hospital. Unfortunately, because we have given medicine to dilate the pupils, it will be hard to drive back, because now the pupils should control light coming in and out of the eye, and they are going to be wide dilated, and you won't be able to control that. That's all we advise. Get someone to drive you back. Some people find it easier wearing dark shades so that they control the light and the light. So the adult diabetics, and this is actually a service that we also offer in our diabetic clinic, we offer screening for this. Every patient who is attending the diabetic clinic in the hospital has had an eye exam, because diabetes will affect most parts of the body. And the key ones that affect one's ability in life is vision. Just imagine if
and
someone
hearing?
can see. Hearing, not that much, but vision, yes. Sensation, you lose sensation, especially in the feet and the like, and then a small wound becomes huge that sometimes you even have to amputate that leg.
Oh, wow. Okay, and then how should we manage in terms of a few sentences or so, because we're getting close to the top of the hour?
Yes.
How should we manage those conditions now that the conditions are there and these are lifelong illnesses?
Yes.
Your final comment on how should a person with this condition manage?
The key thing is the primary objective of our open day. early detection, okay? Because these risks are there, and our behaviors propitiate the conditions. So, regular health checks, even when someone is fine, go to the hospital.
True.
Okay, I like using my side as an obstetrician gynecologist. Have a pap smear done every 4 years. Okay, because it is, like I said, it's quite painful for us to find advanced cancer when there are pap smears. You know, even beyond, there's something easier than a pap smear. It's called visual inspection with acetic acid. Cheaper. Way cheaper. We spray some medicine and just look and say the cervix is normal, it's abnormal. So my key word is wellness checks. We need to up our game. You know, as Africans, we keep on saying, oh, these whites live longer, these whites live longer, but that is what is keeping them safe. Okay, they know their cholesterol, and then every year, even when you haven't gone to the hospital, they call you up. You haven't come in for your tests, you know, and these risks are also stratified. For example, ladies, once you get to about 40 years, okay, make sure you've had a pap smear. Make sure you've had a mammogram. You know, things like that, okay, which is within the wellness packages. That is the idea we had, to put those packages there, and it's one of the main objectives that we want to achieve in this open day, that the community public knows that, you know, these are things, and they are quite affordable. Okay, for, you know, if I compare, I don't know, maybe my boss will shoot me for giving a cost here, but the cost for a wellness check for maybe a 25 to 30-year-old gentleman is about 250,000 only. But imagine the cost for, you know, daily blood sugar checks, daily medication, wounds as a result of diabetes, and you know, all that for just 250,000 a year.
That is, you know, a good reason.
Yeah, that's my take.
Okay.
Thank you, Sophia.
Thank you so much, Dr. Sekweyama. We can't take this lightly. We appreciate the knowledge and wealth you've shared with us. And to the viewer who has been watching into this show right now, I'd like to remind you, get ready tomorrow. The gates open at exactly 7 a.m. That is at St. Francis Nsambya Hospital. It's an open day. You're going to get free consultation, and it's also advisable for you to go and find out how you stand. You don't need to be feeling ill for you to go and have that test done. Please go and use this opportunity to get and find out how you stand as a matter of health concern. That is all we had time for. I'd like to say good night from me and Doctor, and it's just a few minutes to top of the hour. Michael Jordan Lokoma will be coming your way at exactly 10 p.m. with the news. Good night from me.